Hello, I'm Dr. Chandrani, obstetrician and gynecologist in Neotia Bhagirathi Women and Child Care Center, Newtown. Today, I would like to highlight few points about a very important topic, which is bleeding in early pregnancy. That means bleeding in the first 3 months of pregnancy. So before I start the discussion in details, let me tell you one thing, that bleeding in the early months of pregnancy are abnormal. But it doesn't necessarily mean that there are any problems. In some cases, it has been seen that in spite of having bleeding, those women are going to deliver healthy babies. In medical term, we call it threatened miscarriage. So, shouldn't we not be afraid of bleeding? Yes, we should be afraid of bleeding, because sometimes this bleeding are warning signs of miscarriage or other pregnancy complications. Now I will discuss all the causes one by one. First, let's come to the miscarriage. Sadly, miscarriages are common. 1 in 5 women in their early months are going to miscarry in spite of having no apparent problems. But the good thing is, it's usually a one-off event and there are good chances that there are healthy future pregnancies. And miscarriages most commonly present as bleeding and or pain. The next common cause is ectopic pregnancy. That means pregnancy occurring outside its normal position. Usually, most commonly, the position is the tubes. Now, a tube are thin-walled structures. They cannot support a growing pregnancy. So, if we continue to have this ectopic pregnancy, the tube can burst open, giving rise to bleeding inside the tummy, which is a life-threatening condition requiring immediate surgery. And the third condition, which is not very common, it's molar pregnancy. That means there is no baby, but there is a condition where only after birth grows. Now, what you are supposed to do if you notice bleeding? Always take this bleeding very seriously, whether it's a spotting or mild or heavy bleeding, and you need to see your doctor. Once you visit your doctor, you will be taken detailed history regarding the type of bleeding, any associated pain, any fainting attacks, dizziness, or any passage of blood clots, fleshy mass, etc. Then you will be offered some examination. You may also be offered some internal examination to look at the condition of the neck of the womb. You may be advised certain blood tests like pregnancy hormone beta HCG, hemoglobin test, or blood group. And usually ultrasound scan is offered, preferably the transvaginal ones. Now, depending upon the diagnosis, your treatment will be suggested. You may be advised rest, then avoiding some heavy activities till the bleeding subsides. Then you can be offered some progesterone tablets, vaginal pessaries or injections. And in some cases, like in upcoming miscarriage or ectopic or molar pregnancy, surgeries may also be advised. So don't take this bleeding very lightly and always visit your doctor once you have bleeding in the early months. Thank you.